Hello, good afternoon. My name is Mary Keogh O'Sullivan. I am the National Quality Improvement Lead for the HSE Disability Services, and absolutely delighted to welcome you all here this afternoon. As you may have heard me saying, there are over 600 people registered for today's webinar, which I think is testimony to just how important this is to everybody. So I'm delighted to welcome you all to this event to launch the easy to read version of the National Consent Policy. We are going to have a look at the document itself, and then we'll hear from some experts by experience who will talk about why it is important that a person is supported to consent for themselves. Easy to read information is important for people with intellectual disabilities and also for people with other conditions affecting how they process information. The National Office for Human Rights and Equality have put a lot of work into the HSE National Consent Policy, and this easy to read version, which will help each person to know their rights and to be able to make their own choices. This launch event will be recorded and it will be available to watch back on hse.ie/National Consent Policy. And there are also 2 e-learning modules on HSE Land that will support this policy. It's now my pleasure to introduce our first speaker of this afternoon, Elaine Macaulay, Senior Project Manager in the HSE Office for Human Rights and Equality Policy, who will speak about this easy to read document. Over to you, Elaine.
Thanks, Mary. I'm going to show you what the easy to read version of the National Consent Policy looks like and talk about some of the main ideas. But don't worry, I'm not going to read the whole policy to you. A bit of background first. The HSE wrote the first National Consent Policy in 2013. In March of this year, the National Office for Human Rights and Equality Policy published the revised National Consent Policy 2022. This 2022 policy talks a lot about how the most important thing is what the person wants or does not want. Today, we are very happy to launch the easy to read version of the 2022 National Consent Policy. We hope that the easy read version of the policy will be useful for people who use health services and social care services and for the staff who support them. In the policy, if you give consent, it means you say yes to a medical treatment or test. You're agreeing to have that treatment or test. Consent can also mean that you agree to use a health service or a social care service or a health or social care support. Consent applies to all interventions. If you refuse consent, you say no. You do not agree to a test, treatment, or service. You do not want to take part in research or teaching. The policy sets out the rights of people that use health and social care services. It says how staff must respect these rights. We hope that the easy-to-read version of the policy will help everyone understand their rights in this area. The policy says that healthcare workers must start with the idea that each person is able to make their own decisions. Each person should be supported to make their own decisions wherever possible. All healthcare workers must follow the HSE National Consent Policy. This means asking for consent from people in hospitals, in community or primary care, in day services, residential services, and respite services. Anyone delivering services on behalf of the HSE. Part 1 of the policy is the key points or general principles. Adults have the right to control their own lives and decide what happens to their own bodies. Asking for consent should be a two-way conversation between you and the healthcare worker. You should have time to think about things and the opportunity to ask questions. So this two-way conversation can happen over time or over a number of visits or sessions. A healthcare worker should always ask for your consent before they do anything. The healthcare worker giving the test or treatment or service must make sure that you're asked for consent. The healthcare worker should explain what the test, treatment, or service is for. They should tell you if there are other options, or what would happen if you didn't have any treatment. The healthcare worker should explain how the test, treatment, or service might help you, but they should also tell you about any risks. The healthcare worker should give you the information you need to make a decision. You should have this information at the right time and in a way that you can understand. So this might mean providing information in plain language, in pictures or diagrams, or in an easy to read form. You can change your mind and take away consent at any time. You can give or refuse consent in different ways, for example, by speaking, by nodding your head, writing, or using a communication device. There must be a way for you to communicate if you change your mind and cannot use words, maybe because you have a communication difficulty, or maybe because of the procedure, such as a dentist doing work in your mouth. For example, you might be able to put up your hand to say stop. Healthcare workers must respect your decision to give or refuse consent or change your mind. They must respect the decision, even if they think it is not wise. The policy has advice for healthcare workers if they think a person is not able to make their own decision. But the policy says that usually no one can give consent for another adult. We will review the policy next year when the Assisted Decision Making Act comes into force, but the fact will remain that no one else can give consent for another adult without the specific legal authority to do so, such as being appointed as a designated healthcare representative in an advanced healthcare directive. Part 2 is about children and young people. The policy respects the rights of children and young people, and all of the points in Part 1 apply to children and young people also. The policy respects the responsibilities of parents and legal guardians. The policy uses the word child for someone under the age of 16, and the policy uses the words young person for someone aged 16 or 17 years of age. All children and young people have the right to give their views, be part of decisions, and to be heard. They can give their views through play, drawing, writing, talking, and body language. The policy says that a young person, aged 16 or 17, can give consent for themselves. Parents and legal guardians have the right to give consent for their child aged under 16, and they should make the best decision for their child. Like everyone else, children and young people should be given information in a way they can understand. And of course, children and young people with disabilities have the same rights as other children. Part 3 of the policy is about research, but this is now moving to a new separate national policy for consent in health and social care research, and this will be published next month. However, we still include some general guidance in the easy to read version. If you are asked to take part in research, you should be given the relevant information. This should include information about what the research is about, the good things about taking part, and the risks. It should say who is organising the research and how long it will last. Section 4 is about do not attempt resuscitation. The policy wants to support you to talk about your wishes and decisions. The policy explains that there are lots of important things to think about before a decision like this can be made. All of our resources to support the National Consent Policy are available on our website, hse.ie/National Consent Policy. We really hope that you will download the easy-to-read version of the consent policy and that it will be useful for people who are using services and for the staff who support them. Thank you.
Thank you very much, Orla, for that. I suppose taking us through the whole policy there. That was really excellent. I'd now like to introduce Aisling Mason, who is an expert by experience, and she's a service user in Enable Ireland. Aisling is going to tell us about what consent means to her. Okay, over to you, Aisling.
Ash, what does consent mean to you?
I decide if I want something or not. I can agree or refuse.
Ash, when are you asked for consent?
Activities in day service, activities in our virtual service, going to the doctor or dentist, or if anyone wanted to take my picture.
Ash, who do you think should give consent for you?
I should give my own consent. As an adult I can and will give my own consent.
Ash, who would you like to support you about these decisions?
My circle of support, my family, my friends, my Enable Ireland service owner friends, my key worker.
Hi, Ash. Ash, you know, everybody needs information on what they're going to be asked to consent to, you know? What helps you understand that information?
Plain language, time to think and answer time for questions, easy read using pictures.
Okay. Thank you, Ash. Good response. So, Ash, what helps you communicate your choices?
My AAC communication device helps me with my choices.
Okay. Makes sense. Thank you. So Ash, you know, you always have the right to change your mind or just say no. So how can you communicate if you do not want a staff member to do something to you?
I use my hand, I use my head, and if needed, my communication device.
Thank you. So Ash, how does it make you feel when other people make decisions about you without giving you any choice?
Horrible, very off angry. I am an adult, not a child.
Ash, how does it feel when you are supported to make your own decisions?
Happy.
Thank you, Ash, for that. That was fantastic.
Thanks, guys. Thanks, guys.
Hello again. Ash, that was fantastic. And it really was great to see the technology in action there, enabling you to communicate your choices. Next, we're going to move on to Paul Crilly. Paul is an expert by experience and a member of the ID Rights in Southeast. Paul was involved as an advisor in developing the easy-to-read version of the HSE National Consent Policy and will tell us about that piece of work. Okay, Paul.
My name is Paul Crilly, and I'm an adult with a mild intellectual disability. I am part of a self-advocacy group called ID Rights Southeast, which means we cover Carlow, Kilkenny, Wexford, Waterford and Tipperary. And my role within the group is to advise around accessible information and also to help with the training with people who are outside of the group, like shops, cafes and stuff like that. And that is my role within the group. I just want to say that, you know, even for my own group and that, we come from a human rights-based approach that, you know, any information that we would look for, we would look for it to be put in a way that we understand, you know, as a right. And that any information that people get, that we would feel that it's very important that it's a kind of a human rights based approach. That's the way we're going down, you know, that way. The other thing as well is it's not just for people with intellectual disabilities. There's other people that may not need and may not understand or be able to read, or, you know, their first language is not English and they may not be able to understand. So we need the information for everyone to be in accessible format in, you know, a kind of a way that they understand. My role with helping out ACE Communications is as an expert by experience. And my role as an expert by experience is to help with the accessible information to make sure that it's accessible for people. What I covered was helping with, you know, accessible information, and also words not being placed in in jargon so that people could understand and make out the words. And I think it would be very important that I can say that you know, that we make sure that words are simplified so people can understand what they're being asked to sign up and sign to, especially if it's to do with consent, that they know what they're signing up to, and they're able then to make an informed decision once the words are not, you know, kind of jargled up, that they're simplified. I worked with ACE Communications and Teresa on, you know, checking that the words were presented on the page and that, you know, there wasn't too much information. And I think it's important that there's not an overload of information for people, that they know exactly what they're, you know, they're going to write down or sign to. So it's kind of I did a kind of a thing with Teresa on making sure that there wasn't an overload of information, and just to check that the information was accessible. I worked with Teresa on the pictures matching the words of the sentences, because I think it's important for people to have pictures matching the text. I know it was important for myself to have the pictures with the sentences, and so that's one of the things that I work with Trees on, and that's what we did. We matched around all the pictures with the sentences. I try to include all the information in the easy to read report. I think it's important for people with disabilities to be involved in the policy because they're the experts by experience, and they know best how they can understand it better. Yeah, I think it's important that if we have information in an accessible format, it will help us make decisions and feel empowered. It's important that we ask people what type of information they want and how they would like to receive it. Yeah, I think it's important that it was great to see that the policy said that who should ask me, why they should ask me, and when they should ask me for consent. I think that was very, very important in the policy. The policy helps me to understand and to help staff understand about consent as well. And that's what the policy. I think the policy sets out for staff. It helps me also with consent and so that I know what to expect. It's important because, for example, if I go to the hospital, that they know what questions to ask me, but also that is important because if people go to the hospital, people with a disability go to the hospital, that they're asked before they get an operation, that they understand what the operation will do. So I think it's important that explains that people are given support with the consent for whatever they're being asked to do. I think having an easy read policy for people will make it easier for people to understand a lot about the policy. And also then for further, as I said, further, if they're being asked further down the line about stuff, they'll have a gist of what they're being asked to do, and it'll be easy for people. I'd just like to say that I'd like to thank ACE Communications for putting all that together and helping me as an expert by experience to have an input into the policy, and that I'm certainly delighted to have taken part in that role.
Thank you so much, Paul, for that, for taking us through that, and delighted that you were actually part of the experience of developing that easy read. And lastly, but by no means least, we're now going to hear from Lydia Fisher. Lydia is an expert by experience, and she's supported by Cheshire. Lydia is going to tell us two stories. Her first story is about her appearance as a ward of court when her right to consent for herself was actually taken away. Linda's second story is about being able to consent to insertion of a contraceptive bar on her own behalf. Okay, Lydia.
My name is Lydia Fisher, and I'm going to take some time to talk to you about consent and what is consent. For me, consent is very important because for me, being part of the consent is amazing. I'm going to tell you when I felt like my consent was taken away from me and when I made my own consent. A couple of years ago, in 2019, myself and my best friend were planning to go to Belfast. And we were all excited planning to go to Belfast. And for me, I couldn't just pack my bags and said goodbye. I had to do more risk assessments. I'm in the High Court law. Pap being in the High Court, the consent if it being taken away from you without they knowing that the consent is taken away. For example, I felt like my solicitor had all the consent. If my solicitor said no, I couldn't have done it. I did all the risk assessments for the holiday and it went above me to my solicitor. If my solicitor had said no, I couldn't have done it. She took some time to read everything, all the documents that myself and my carer have sat down and done. And she came back, she said, I can go on holiday. That was good that I went on holiday, but it wasn't good because I could not have made the consent myself. It was frustrating because it was a small consent, but it was say something was taken away. I could not made it myself. My other one is putting to buy in my for me a few years people have told me it would have been best for me to put it in my arm and not just went with it because I didn't really know the meaning of consent really. But this year I said no, I wanted to do it for myself. I went to the doctor. I talked to my doctor and my doctor explained to me if it's still working for me, what to change. I went to the chemist and I got the buy. I felt wonderful because I know that consent that I was making, it was for me, not for anyone else. I went to the doctor and I put it in. I also had to just check in with Cheshire for them to put it in my notes just in case I got sick and they would know what went on during the few months prior to that. But for that being in my this time, it was my consent, not anyone else. So remember, even though there's small consent for someone will mean a lifetime. So always ask yourself if you have asked the person who you're working with, it's them consent, not what you think they want. It's their consent. Thank you for listening.
Lydia, thank you very, very much for those powerful and very personal stories, which show us all exactly how important it was for you and how important it is for every person that they are supported to make their own decisions. Thank you to Aisling Mason, Paul Crilly, and Lydia Fisher for sharing their experience and for supporting the launch of this document today. And well done to the team for developing it as well. The easy-to-read version of the National Consent Policy and a recording of today's launch event will be available to watch back on hse.ie/National Consent Policy. Thank you all very much for joining us. Bye-bye.